good morning.
Good morning.
Hello, my name is Christina. I'm a student with TCC. How are you?
I'm good. How are you?
Good. I'm going to do some hand hygiene. I'll get some gloves on in just a moment. Can I get your name and date of birth?
Heather Marks, 5995.
Good. And I have Heather Marks. Perfect. All right. Let me get my gloves on. We're going to do a head-to-toe assessment, okay?
Okay. What's
Right.
that?
What we're going to do is we're just going to do a whole review of all of your systems from your head to the tips of your toes.
Okay.
Okay? All right. Miss Heather, are you allergic to anything?
I'm not.
All right. Very good. No medications, no food. Wonderful. All right. And you know where you are today?
I'm at Texas Health HEB.
Good. Do you know what today is?
Today is Saturday.
Good. And do you know who the president is?
Mr. Joe Biden.
Wonderful. All right. Already I can tell that you are alert and oriented ×3. Your speech is clear and understandable. Your mood is wonderful and pleasant. You're such a sweet girl. But we're just going to do some general assessments and then we'll get started, okay?
Okay.
All right. Are you having any pain today?
A little bit.
Where's your pain?
In my back.
In your back?
Yeah.
Okay. What kind of pain is that?
It's like a tingling kind of that like goes down my legs a little bit.
Okay, like down towards the back of your legs? Yeah. Okay, and how far does it go?
All the way to my feet.
All the way to your feet. Okay, how long has that been going on?
Like 3 or 4 days.
Okay, 3 or 4 days. Do you know when that, do you know what started it? What triggered that to happen?
I don't know.
It just kind of started out of the blue. What makes it worse? What aggravates that pain?
If I sit for too long, basically if I stay in one position for too long.
Okay, so getting up and moving to another position is helpful?
Yeah.
Okay, what else helps alleviate that?
Heat,
Mm-hmm.
or like if I lay on my back with my feet up.
When you elevate your feet?
Yeah.
Okay, that's good. That's really good for circulation, so I'm glad that helps. What would you rate your pain when it's at its worst?
Like a 6.
Okay, and your pain right now?
Like a 2.
Okay, very good. All right. Well, I can tell you're very well kept. You look clean and groomed. Your facial features look symmetrical, and you look very happy. I'm just gonna take a quick look at your hair.
Okay.
Your hair looks nice and healthy. Doesn't look like it's thinning. No hair loss. Very good. You have a nice shine to your hair. Very pretty. All right. Again, your face looks symmetrical, but I'm going to start with your eyes. Is that okay?
Okay.
All right. If you just want to look straight back to that wall,
Okay.
just shine a little light. Good. Pupils are equal and round and reactive to light. If you could follow the tip of my pen. Eyes are also accommodating. All right, I'm gonna just pull down on your eyelids a little bit, okay? Good. Conjunctiva, the pink in your eye is pink, and your sclera is white. That's what we want it to be. Okay, do you wear contacts or corrective lenses at all? Any glasses? No? Okay, do you have any issues with your vision, blurring at times? No? Okay, you don't have any history of that?
Nope.
Good. All right, we're gonna look in your nose.
Okay.
Go ahead and put your head up for me. Good. Nares are round and equal themselves. They look like you have any septal deviation. Have you had any trauma to your nose?
Mm-mm.
Good. I didn't see any drainage or anything blocking in your nose. So you had good pink mucosa. I'm gonna look at your lips. Your lips look like they're pink and moist. No sign of stenosis around the lips. I'm gonna take a look inside your mouth. Okay. No teeth decay, doesn't look like you have any bleeding gums. Your mucosa is nice and pink. You don't have any lesions in your mouth. Do you have are you able to swallow and chew okay?
Yes.
Yeah, okay. I'm gonna look at your ears as well. Right, good. Awesome. No drainage in that. Doesn't look like you have any damage to your tympanic membrane. Are you experiencing any hearing loss? No, you don't wear any hearing devices? Good. Alrighty. Sounds good. I want you to raise your neck all the way back up to the ceiling and then your chin to your chest. Good. Can you look to your left and right for me? Good. Alright, you want to sit up for me just for a second? Go ahead and push your shoulders up. Good. Alright. You had full range of motion independently, which was active range of motion, and your strength was good as well.
Good.
Awesome. That was on both sides. That was good. All Alright, I'm just going to, we're gonna move on to your lungs. Do you have any history of smoking, asthma, any trouble breathing, shortness of breath,
Nope.
Any recent cough?
Nope.
Do you use oxygen at home?
I do not.
Good, alright. Just looking at you, you look like you breathe symmetrically. Your chest itself looks structured symmetrically. It doesn't look like you're trying really hard to breathe. No labored breathing, so it looks very regular. I'm gonna take a quick listen, okay?
Okay.
Go ahead and sit on the edge of your seat. Every time my stethoscope touches your chest, just go ahead and take a deep breath.
Okay.
Do a 2 on your side, okay? Awesome. I'm gonna move your hair, okay? Last one. Good. And your breath sounds were equal and clear bilaterally on both sides, so that was really good. I didn't hear any wheezing, crackles, or rhonchi, so everything sounds clear, and you don't have any labored breathing, which is good. All right. I'm going to give your heart a listen, but first, do you have any history of congestive heart failure, any circulatory issues, or chest pain at all?
Nope.
No? Okay, very good. You take a quick listen.
Okay.
You just breathe normally. You don't have
Okay.
to take in deep breaths for this. Good. Your S1 and your S2 are audible, very clear, a good strong lub dub in those heart sounds. But if I did hear any abnormal rates in that, I would just listen to your apical pulse. That's right at your mid-clavicular line at that 5th intercostal, and I would listen to that for about a full minute. Okay. Any other issues or questions moving forward? Good. All right. Let's go ahead and I'm going to lean you back. We'll look at your abdomen, just right there. There you go. Perfect. All right. Miss Heather, do you have any history of abdominal surgeries, procedures? No gastric bypass or Lappian's done? Good. Any current nausea, vomiting, indigestion, constipation, diarrhea? No? Okay. Well, looking at your stomach, it doesn't look like you have any abrasions, marks, or scars. It doesn't look like you have any distension or bloating. Do you have any stomach pain or problems right now?
Nope.
Okay, I'm just gonna take a quick listen if that's okay.
Okay.
Sorry.
It's nap time.
All right, we're gonna start on this right lower quadrant. Lots of sounds, lots of good gurgles. You are normal, active in all 4 quadrants, which means we're just having a lot of good gurgly sounds. Things are working properly. And you said you don't have any stomach issues. Are you okay if I press down on it? If you have any discomfort, pain, or tenderness, just let me know, okay? How's that? Good? Yeah? All right. I didn't feel any enlarged masses or organs, and I didn't feel any distension or bloating. Can you tell me about your last bowel movement?
It was last night.
Last night? Okay. Can you tell me what it looked like?
It was like solid but still like soft.
Okay.
And it was like a medium brownish color.
Okay. Is that your normal
Yeah, it's pretty normal.
Okay, and do you go to the bathroom at the same time every day?
Yeah, like every other day, but yeah.
Okay, and it's that same.
Yeah.
Okay, all right. What's your diet like?
I eat a pretty well balanced diet.
Okay.
I eat like 6 meals a day.
Good.
And I eat like a lot of protein, carbs, and vegetables and fruits and stuff. So.
Good. Good for your metabolism. Very good. All right. If you're okay, I'm gonna sit you on up. Okay.
Okay.
All right. If you want to use this toggle on the inside, I'll leave this part. Okay. We're just gonna look at your skin really quick. Your skin looks nice and soft and smooth. You have warm texture. It's okay. You're nice and warm, smooth and dry. You do have some freckling, which is normal. I don't see anything that I'd be concerned about. And you're free from hives and discoloration, which is good. You have like a natural like pinky undertone, which is good. I'm just gonna squeeze. Good, no edema. I'm gonna check your fingers here, if that's okay. All right, you don't look like you have any like clubbing of your nails. No, your nail beds look really good and pink. Check for capillary refill. Good. Less than 3 seconds. Okay, if you want to just grab my fingers real tight. Good, grip strength is good. Awesome. Perfect. All right, I'm gonna look at your back really quick, just make sure skin is good. Let's see the back. Good. I don't see any reason, like any risk of pressure ulcers or anything, so that's really good. And no IVs. We don't have any ports in, no lines, so we're good there. Otherwise, I would have to assess those and make sure we don't have any infiltration or infection in those. But now that we're good with the skin, can I have you do some walking for me?
Mm-hmm.
Okay, I'm gonna have you stand up and walk. Actually, I'm gonna start with your upper. Is that okay?
Okay.
Okay, let's start there. Go ahead and raise your arms all the way up for me and all the way down. Good. Any pain in that?
Nope.
And then up here and down. Good. How's that?
Great.
Can you bend here and out? Wonderful. No pain in that?
Nope.
All right. If you have your arms like this, I want you to push towards me. Good. And pull towards you. All right. And then let's do in and out. So push in and then push out. Have your arms flat and then push down. Good. And then up. Wonderful. Any pain in those?
Nope.
Okay. Let's do the same with your legs.
Okay.
Have you keep your legs bent and then go out and in. Other leg, out and in. Any pain in those?
Nope.
Good. Can we do one knee up to your chest at a time? Good. Any pain? How does that feel in your back?
Are you okay?
Felt good? Okay. I'm gonna come down here. Can I have you take off your shoes and socks?
Yeah.
I'm sorry.
No, it's okay.
I'll help you. That's okay. I'm gonna lift this out for just a second. Observe, and then we'll do the strength on the
Okay.
bottom, okay? All right. I'm gonna just feel here. Good. I'm gonna do this here. Very strong. Awesome. All right, so your dorsal pedis and then the tibialis are both normal, 2+. That's what we wanted. They're equal on both sides. I'm gonna just look at your toes. Your nail beds look good. All right, I don't see any stenosis, just like your fingers. We have good circulation. I'm gonna do some capillary refill. Good. Less than 3 seconds. Good. All right, I'm gonna move you back down, okay?
Can I put my socks back on?
Yes, you can. We're gonna do strength, and then I'll have you walk, and then we're gonna do your radial pulses as well, okay?
Okay.
All right. I just wanna check your strength. So push towards me. Good, and then towards you. Good, and then in. Good, and out. Wonderful. Any pain in that? Did that hurt your back at all?
Nope.
No? Okay. I want to have you walk to the door.
Okay.
And then come back for me. Good. Your gait and balance looks stable and steady. Very good. Any pain that with your back moving at all? Okay. I'm just going to come back up here and check your radial pulse. Here we go. There we go. Perfect. Good. All right. Normal +2. That's what we want. Okay. While I'm here looking at your hand, I'm just going to do some skin turner. Good. You drink a lot of water, so see, it's normal. From here, because you drink a lot of water, can you tell me how much you do drink?
Like 5 or 6 water bottles a day, probably.
That's very good. Okay. What does your urine output look like?
It's usually like a light yellow color,
Okay.
and it, yeah, it doesn't like smell or anything like that.
Okay. How often do you go to the bathroom?
Like 2 or 3 times a day.
Okay. Good. There's no pain, no itching, burning when you go to the bathroom?
No.
Very good. All right. Do you have any questions for me?
No, I don't think so.
That's good. I know that we don't have an indwelling catheter, but if we did have a catheter, I would assess that, make sure there's no infiltration or infection there. We would just assess that area really good. But if you're good, I can go grab the doctor.
Okay.
Okay.
Yeah.
Here is your call light. You're at a good low position to get up, but if you need anything, just give us a call. Okay.
Okay.
Anything at all doesn't have to be emergency.
Okay.
Okay.
Thank
All right.
you.
Yes, ma'am. I'm gonna take these off and put my hand hygiene and head out. Okay.
Okay.
Awesome. Thank you.
Thank you.